We begin this evening with the coronavirus and word from the World Health Organization today that the whole world needs to be on alert and be ready for any new cases of the deadly virus, which has killed more than 130 people.
5974例，现有重症病例。
This comes as China's National Health Commission confirms close to 6,000 cases of the coronavirus in that country, more than 1,200 of them severe. The outbreak has killed at least 132 people on China's mainland. Earlier today, a U.S. government chartered plane carrying more than 200 diplomats from its consulate in Wuhan, the epicenter of the outbreak, touched down on American soil. Those evacuees will now undergo health screenings here in the U.S. While not yet formally declared a global health emergency, the outbreak of the coronavirus is making headlines around the world. And joining me now to talk about the coronavirus is Dr. Robert Tiballi. He is an infectious disease specialist and a member of the Catholic Medical Association. Dr. Tiballi, thanks so much for joining us.
It's my pleasure to be with you tonight.
Well, let's talk about the coronavirus. What are the symptoms and how is it spread?
Well, right here now in the United States, we don't have actual spread of the coronavirus, but it's a little bit different than influenza. Influenza is very rapid and sudden in onset. You feel like a truck hits you, high fevers, chills, muscle aches. The coronavirus basically starts out with a very low-grade symptoms, including some fever and some cough and some shortness of breath. It then progresses. But influenza is much more fulminant or aggressive in its onset as compared to the coronavirus.
As an infectious disease specialist, what are the challenges in containing a virus like this?
Well, it's what we don't know. We'll know more about the virus in the weeks and months to come, but right now we're just learning information about how the illness is transmitted. It's just been a few days that we understand that the incubation period is 14 days, and early in the incubation period, people may actually be infectious for the virus and could transmit it to other unsuspecting individuals. In fact, in Japan, today was confirmed the first dose of a person-to-person transmission of coronavirus in someone who has no known contact with any Chinese national or being in China. So as far as I know, that's the first transmission in the world of person-to-person transmission outside of China.
How concerned should we be here in the U.S. about contracting the coronavirus?
Well, right now, very low concern unless you just return from China, especially the Wuhan area, or you're in contact with people who similarly came from China. But right now, the general population of the United States should be much more concerned about catching influenza or some other normal wintertime contagious illness, not the coronavirus. Now, that being said, I do tell my patients not to be an alarmist, but everyone should be prepared for having a week's worth of food at home. We don't know if we're going to get snow and lose power for a period of time. You want to be prepared, but you should not be anxious or panicked about this virus this time. In the weeks to come, in the months to come, we may find this virus taking a foothold here on the continental United States, but right now there is no person-to-person transmission occurring here in the U.S., and there's only been, I think, 5 or 6 cases in the United States, and we're a nation of 330 million people, and the risk for any citizen here in the U.S. contracting it is extremely low. It's virtually non-existent.
We've seen the videos of people lining up and they are wearing those masks, those face masks. Are they helpful?
Well, they're helpful for things like influenza, but it appears that the coronavirus may be transmitted not only into the mouth region by breathing in, but it may be transmittable to the mucosa on the eyes. And so if you came in contact with a mist expelled by someone, either coughing or so on, and got a droplet in your eye, you could acquire this infection. And therefore, in China, people are wearing goggles of some sort of fashion or a full face mask to protect them from acquiring the illness from another person.
Dr. Tiballi, before we leave, one quick question. There have been a number of deaths in China from the coronavirus. Are there any plans for a vaccine? And if so, how quickly could that vaccine be turned around?
Well, Johnson & Johnson's already announced that they believe that they can develop a vaccine fairly quickly. There's been vaccine research into previous coronaviruses, the SARS virus back in the early 2000s, and then the Middle Eastern respiratory syndrome, which was far more deadly than the SARS virus. So depending on the genetic makeup of this virus, they may be able to develop a vaccine fairly rapidly, but very rapidly would be less than a year. It's breathtaking the speed at which medical discovery occurs these days, and they can genetically decode this virus very rapidly, and I believe that's already been done, but it hasn't been announced. So we won't have a vaccine for many months at the very minimum, and that would be a very, very rapid vaccine development.
Okay. Well, Doctor, thank you so much for joining us. Dr. Robert Tiballi, an infectious disease specialist and a member of the Catholic Medical Association. Thanks so much for joining us.
Thank you very much.